Welcome to today's video in a series we're calling COVID-19, Patients, Families, and Providers in Conversation. Broadly speaking, what we're going to be talking about is all of the safety implications of having a non-emergency procedure in hospitals during the time of COVID. My name is Rachel Weisberg. I have worked in hospitals over the last 15 years in various capacities in patient safety, care coordination, both inside the hospital and out in the community, making hospitals more patient-centered, and various other aspects. So we will be joined today by two special guests. I want to first introduce Kellie Goodson, who leads Performance Improvement Networks for Vizient. Vizient is the largest member-driven performance improvement company in the country. Kellie has expertise in many areas, but the reason we've asked her to join today's conversation is because she recently organized a really thoughtful webinar on this particular subject of elective procedures in hospitals during the time of COVID, in which many patient and family advisors took part. Welcome, Kellie. Our second guest is someone I've had the privilege of working with for several years now as well. There's just no way to summarize Pat and all of her many gifts and the ways in which she's contributed. Pat Merryweather-Arges, she is currently the Executive Director of Project Patient Care. She has been the Vice President of the Illinois Hospital Association. She has extensive knowledge of performance measurement, and she's worked very closely with government at all levels to improve patient care. We've asked Pat to join us for this discussion because she recently helped to write some very detailed guidance for Illinois hospitals from the perspective of a patient, a family member, and the general public. So welcome, Pat. Kellie, I thought we could kick off this conversation with you by having you just explain a little more in detail what is an elective procedure and why are we having this conversation as a country right now?
Thanks, Rachel. Thanks for having me. I'm really excited to be here with you today to talk about this really important subject. And, it's a scary time for all of us. And, when we think about going back in and doing health procedures, there's lots of things that come into our minds. At Vizient, we really wanted to know what patients and families were thinking about as we restart these elective procedures. So just to talk about really what kind of procedures we're talking about, the word elective kind of implies that it's optional, but that's not the case. Elective really only means that they're not highly critical or time sensitive. So, it's not based on a trauma or some sort of potential loss of life or limb. So the term elective is used really broadly. And just to help our patients and families out there understand how healthcare providers think about these elective surgeries, they really bucket them into different categories based again on sort of that time sensitivity. So when we restart elective procedures, we're going to look first to restart those that have imminent risk to life or limb within 48 hours. So if you just think of that, if you're going to lose your life or a limb within 48 hours, you're kind of first up on the block. Cancers, heart attack, bleeding, things like that. The next sort of category is patients that are at risk of losing life or limb between 2 days and 30 days. Sometimes we just sort of pick these time frames, and some of it's based on historical evidence, some of it's just sort of common sense in the thoughts of our healthcare professionals. So, acute appendicitis, infected wounds, tube placements, things like that, even some amputations. And then we think about the long-lasting harm that's possible, or like there's a risk of mortality with whatever issue that you have that you need to go in and have that procedure done. And that's really between, the next bucket down is between 1 month and 6 months. So, that just sort of gives you an idea of how the healthcare providers look at it. There's several buckets down the line after that, and it really has to do with chance of mortality or chance of things getting even worse if you don't do the procedure. So, what the healthcare providers have to think about is the capacity constraints. Is the OR available? Where is it located? Who's going to staff it? All of the supplies that are necessary that go into it. So, even things as pharmaceuticals, the drugs, the anesthesia drug, the antibiotics, and things like that. So there's healthcare is complicated, and there's really a lot to think about as we go through this. we oftentimes just think from the provider side, and we need the patient voice in as we start to think about these procedures. What are the concerns of patients and families, and how can we address those to ensure that people won't delay care any further? It's already been delayed in some cases, and we want to make sure that we're not delaying it any further.
Thank you, Kelly. That's really helpful. Pat, I was wondering what your response to that is, if you have other thoughts in addition to Kelly's, and also specifically if you could give us an idea of what safety protocols you're aware of that hospitals are already preparing to prepare themselves for the elective procedures.
Thank you, Rachel, and it's great to be here with everyone. I'm glad you're asking about, the patient's perspective and how they're being incorporated into the hospital's decision-making about how best to open up elective procedures and surgeries within a hospital setting. And there are some things that they have specifically asked for. And hospitals, what I am finding, are actually going and being very proactive in telling providers, patients, consumers, and caregivers what exactly they're doing. And so some of the areas in which they're most concerned from a patient perspective that the hospital is responding is separate entranceways, so that when they come into the hospital, they're not coming in the same way that a COVID-19 patient is, or a suspected COVID-19 patient. They are separating the COVID-19 patients in treatment from the non-COVID-19 patients. They also are making sure that if they're staying within the hospital, if they've got a hospital stay, it's not just a one-day surgery or procedure, multiple days they're going to be in, that they are separated from the COVID-19 patients. And again, they want to see a clear delineation between the patients. And then the other area is they want to make sure, because they've heard about this, that COVID-19 is sort of, people can be asymptomatic, so they don't show the symptoms. They want to make sure that the caregivers, the healthcare workers that treat the COVID-19 patients are not also treating the non-COVID-19 patients. So again, what we're seeing are a number of issues that they want addressed. And they also are very concerned about, right at the beginning, what's my post-acute care going to be like? So they want to get a picture of that so they can plan ahead. And again, this is all about, raising the comfort level. And I have seen hospitals now doing promotional material, but it's also making sure the physicians, the clinicians that will be working with the patients are prepared to respond with the same responses as well.
Thank you, Pat. I wanted to go back to Kelly and hear, Kelly, what is the feedback that you've heard so far from patients and families in terms of their comfort level at this point with having elective procedures, and what are their main concerns and priorities?
Yeah, it's exactly like Pat said. There's really a lot of concern and a lot of things the healthcare providers and facilities need to do to address these concerns if they want the patients to come back and do these procedures. As you mentioned at the top of our video, you were part of a panel discussion we had just a few weeks ago. We had over 40 patient and family advisors from across the country, and they really gave us a lot of insight on what is important to them as we restart procedures. It was interesting because 56% felt somewhat safe going in for a procedure, yet the conversation that was an hour long really brought out all the things that the patients and families need to feel safe. So we trust our doctors and nurses, but we still want to hear about the changes. We want to see the changes, like Pat said, separate entryways possibly. If you tell me you're disinfecting this area every 30 minutes and I'm sitting here for more than 30 minutes, I need to see some people cleaning this place, because that's what you said would happen. So there's a big trust factor that is sort of inherently there but it can be broken very quickly. One thing we really learned was that person's relative risk level of getting COVID is really important to their decision to move forward with an elective procedure. So we actually have a full report listed that we can share with those listening. It's on our Vizient website, and we really thought of this as sort of a bell curve, or that diffusion of innovation curve, if you know what that is, where we've got different waves of patients that will proceed with some of the healthcare services that they need, and it really is around their risk of getting COVID. So there's the leading folks that I mentioned that will come in because they need this procedure. Their life or limb is in danger, and they really need that procedure, and they're going to move forward no matter what the risk might be of getting COVID, because the risk of not moving forward with that procedure is greater. Then you have a group that feels that somewhat safe, that big number that I talked about, 56%, because their risk of getting COVID they feel is low. They're younger, they're healthier, they don't have underlying health conditions, or the procedure that they're getting is something that doesn't require a lot of follow-up. It's a simple one-day outpatient procedure, and they can be done with the healthcare system at that point. But then there's this whole other half of the wave where they don't feel very safe, and they really want to know what safety procedures and processes are in place to convince them to move forward. They want to talk to their doctor. They want to hear directly about the pre-procedure processes all the way through discharge. And they actually want a loved one with them as they go through these procedures. We've had restricted visitation. I think some that can lift that restrictions a little bit might be a little more successful in getting patients to come in. And then we've got the last group, and I believe you are a member of the last group, that you really want to see a vaccine or a proven cure before you're going to move forward with any type of elective procedure. So it's very eye-opening to see these different waves of patients and family members, because it wasn't based on age, it wasn't based on diagnosis, those typical demographics. We try and put people in those boxes. It was based on their perception of their risk of getting COVID.
Thank you, Kelly. It's really good to hear that feedback from patients is being taken so seriously and is really being thought through on a very nuanced level. And you already covered our next question, which was all about risk level. And yeah, it's completely different for each patient. As you said, I am in a very high risk category because I'm HIV positive. So be an extreme situation that I would find it worthwhile get an elective procedure done before I have a vaccine. But like you said, for many patients, that's not the case. They need something done, given the circumstances and assurances from their doctor or hospital. It could be in their best interests to have that procedure done. So there are a lot of pros and cons being thought through. The next topic that I sort of wanted to circle back to, since it was already brought up by Pat, so Pat, I'd like to come back to you with this, is the subject of post-acute care and rehab. Obviously, most rehab involves physical touch. So I'm wondering, Pat, what your thoughts are about how hospitals are thinking through that issue and the different safety issues involved in it.
And I think for patients, it's knowing what to expect. So knowing that they're going in for a particular procedure or surgery, is what should they expect in terms of the physical interaction that will occur, as well as their options that they may have ahead of them. Most healthcare rehab isn't going on within a hospital setting following a procedure that. So they're going to be going to probably one of three settings. One is home, and so they'll want to know, do I have the medications? Do I have the supplies that I need? How can I make sure that, if I had a surgical procedure, I don't get COVID-19 from somebody that comes in to help me out. So they need to make sure that they have the necessary supplies and also medications. And then if they're going home with home health, that has to be arranged as well. And there's risk, where you talk about reducing risk, there's risk with home health because they are the organizations, the providers that have had the least amount of access to personal protective equipment. And yet they definitely need to come in with personal protective equipment And that all needs to be arranged before the patient goes home. And then the third area is rehab facilities or nursing homes. And that's where the healthcare providers can help the patient and the family in making decisions about the post-acute care, the rehab services, or nursing home services. And I say that because everything's on lockdown. So it's not like a patient can make a visit to a rehab facility or a nursing home. They've got to depend upon the healthcare provider, the hospital provider, to help them get to the right location and make them feel safe. And I think this is one of the areas where most people feel most vulnerable. And so, again, reducing the risk that they have in terms of going to any of those settings of care. And one of the things that is very helpful too is engaging the family or the caregivers right at the onset, because anyone that's had surgery or an invasive procedure know that it's hard for recovery, and the last thing you're thinking about are all these other issues. So it's great to have somebody along with you for the post-acute care services and rehab.
Thank you, Pat. And yeah, the role of the family can't be understated, and we're going to definitely be talking a little bit more about that later. One issue that I wanted to talk about is that Kellie, on the webinar that you organized, the subject of data came up a lot, and patients' desire for data. And you've already mentioned that patients, they want information to make safe choices. And obviously there is limited data around, all of this because COVID is so new, but I was just wondering what your thoughts are about how hospitals are helping patients make safe choices given all of the unknowns that are still out there.
Yes, data is important to patients and families. I think that is a little bit underestimated by our healthcare facilities and our healthcare leaders. But in order for patients and families to feel safe, to trust the healthcare system, their local healthcare system, they want transparent communication, they want frequent communication, and they want that communication to include data. How many COVID patients are there in the facility? How many have recovered and gone home? How many staff have COVID diagnoses? How many have recovered from that? Really no detail is too small to provide to patients and families to really make them feel that you are being transparent and that the facility is safe for them to go into. Even, as far as when we're starting these elective procedures, how many people have had procedures since you started back up? What have their outcomes been? If I'm going in for a particular procedure, I want to know how many of those have you done already, and did any of them have COVID? So there's a lot of data and details that we can provide to patients and families in a transparent way, in an aggregate way, so we're not sharing any personal health information, but we need to have these discussions with patients and families, because the more comfortable that they feel coming into our facility, they're going to want to follow the rules. Number one, they want to know what you're doing so they can be part of that. If I need to wear a mask, I need to know to bring one from home. If you don't want me wearing gloves, I need to know that. Are you going to give me gloves when I get inside? Or can I bring, gloves in my purse and then, use them once I get inside? It's really down to those details, and the data just really helps drive it home for people. One organization that's doing this well is the Medical University of South Carolina. I've been in talks with them, and they were on a recent webinar for Vizient, and they're really communicating openly with patients and families that they're ready. They even had a cute video that's on YouTube from the Children's Hospital, where they had a star patient, Rainbow the unicorn, that they had walked through the process of coming into the door and using the hand sanitizer, and then going back to the room, everyone wearing masks and gloves, and sharing that 2-minute video on YouTube broadly with their patients and families can go a long way to making us feel safe and really understand what they're doing to keep us safe.
I love that, Kellie. I think that you make such a great point when you say that there's no information that's too small that patients want. I think that you're right that providers often think, oh, they wouldn't be interested in this, or this is, over their heads, or it's too, healthcare speak or whatever, but they often patients and just the public in general are far more interested in facts than they think. So I think it's really great that realization is sinking in. And I love your example of MUSC and what they're doing. I think that that's really fantastic. Pat, I wanted to hear your thoughts about anything that you've heard in the last minutes of conversation that I've had with Kellie, but also we're coming to the end of our conversation, and I wanted to circle back on the subject of families and just what an incredible part of decision making they are for any patient who is considering having an elective procedure. Obviously, a lot of hospitals have a no visitor policy or pretty strict policy around visitors right now, and so just anything that you've heard around, relaxing that rule, just like to hear your thoughts around that.
The guidance for hospitals in terms of visitation is really from CMS and the Centers for Disease Control and Prevention. And it's really focused on two key components. One is controlling any spread that could occur in a hospital. So you've seen them go through great lengths to make sure that the spread doesn't enter the hospital from somebody else, but also that it's contained within the hospital setting. And then the other area is to protect the healthcare workers. We know that about 8% of the persons identified with COVID-19 are healthcare workers, and in some states it's much higher. So again, there's two components to that, and of course protecting the visitor, the person that's coming in. Now, there have been relaxation of some of the rules, and it really is important for a patient and their family to ask ahead of time what type of rules, what rules do you have in place? For example, if you're coming in for elective surgery, they may, if they can stagger it and keep you in a different area, they may allow a visitor in, or you may be sitting in the car outside waiting for them if it's a one-day surgery. Now, they do allow, for most hospitals will allow somebody to come in, a partner to come in for delivery, but that person has to be in full personal protective equipment. They're going to have the mask, the guard, face guard, the gown, and the gloves on, and they're only going to be able to stay within that setting. They're not going to be able to wander outside of that setting. It's a closely controlled environment. The other is for compassionate care. Now, this is compassionate care where the patient is not in a COVID unit where there's other COVID patients. Usually they can try and move the patient to an area so that the family can come in, or it may be a patient that's also non-COVID-19 but is at end of life care. They will allow somebody to come in, a family member to come in. They'll be, again, in full protective equipment. And I do want to tell you that for both of those situations that I identified, the delivery as well as the compassionate care, they will stop you as you're entering the hospital. They'll do an assessment of your temperature, and they're going to also, you're going to fill out a form about any symptoms or that you might have, because they also want to make sure that you're not bringing anything in. So they do provide, they're trying their best to provide that family level of support. And another area is trauma care. And when I say trauma, it's not just the person that's in an accident or something happens to them. It's also when a patient is in trauma. And I just had this experience this past weekend. We have a family member that went in for what was supposed to be a normal elective surgery on Friday, and they discovered the reason there was difficulty breathing is because there's a massive trachea as well as thyroid cancer, a very aggressive cancer. And it was so sudden that they found this that they did allow our family member to go in and be with that person while the news was being delivered, as well as ongoing visitation, because it's a very fast and aggressive cancer. So I do believe that hospitals understand the value of having patients to have their family members, to have their loved ones with them. We also see them using quite a bit of, iPads, FaceTime, Skype, and all of those. And sometimes it's the hospitals that are providing that capability so that the patient has access. I don't think the hospitals have ever forgotten the importance of the family. It's just, how do you navigate around it? And it's important to ask as you're going into the hospital or a loved one is going into the hospital.
Thank you, Pat. Such a thoughtful answer. I'm so sorry about your loved one. You raised so many great issues. And I do want to say that one of the issues that you raised was the subject of telehealth and how it's being used right now during COVID. We are going to be covering that as a separate subject on this series. So if you're interested, please sort of tune in for that later. We are coming to the end of our conversation now. So I just wanted to thank our two guests for their participation. Pat and Kellie, thank you so much for your insight and just your time today. It's really valuable. And to all of our listeners, thank you for joining us. We wish you to be safe and well.
Well, thank you, Rachel, for having me on today and putting forth the voice of the patients, families, and caregivers, along with the healthcare providers. This is a wonderful series that you're doing, and I appreciate the opportunity to get the communication out to the patients. Thank you.
Thank you, Rachel. I've really enjoyed being here and really am looking forward to the next series of topics that you have on the video series. It's really excellent. So thank you.